Today we're going to talk about structural and functional changes of the dentofacial apparatus in a facial tooth loss. Examination of patients, structural features and comparative characteristics of different types of facial dentures indications, and about prosthetic preparation. My name is Andrei Filon. I am assistant professor of the Department of Pediatric and Surgical Dentistry at the Paris State Medical and Pharmaceutical University. Today we're going to talk about situations when our patients losing their teeth, and what's going to happen in a while, in time after losing teeth, with gum, with a bone level, the tissue level, soft tissue level, bone tissue level. They're going to talk about how to fix the situation. We're going to talk about difference between plastic prosthetics and bridges. We're going to talk about how situation with gum, with gingiva and soft tissues in general, and bone tissues gonna change in 6 months, in 1 year, in 2 years after extraction of the teeth. So let's start. We have to start since diagnostics. Examine patients, about checking patients just from first visit, yes? And let's talk about examination of patients. When examining patients with partial tooth loss and drawing up treatment plan, more than ever, it's necessary to take into account the physiological aspects of this problem. Partial tooth loss itself almost always leaves a mark of the patient's psyche. In young people, complete loss of teeth, even more accidental causes, creates a feels of physical infertility. Is severe to great extent in a woman than in men. In older people, partial loss is regarded as sign of pending grief. Loss of teeth is not only about aesthetic problems. It's not only about problems with taking food. Yes, it's a complex problem. It's some psychomental problems. Yes, for example, young people, especially women who's losing their teeth, front teeth, for example, let's call it smile line. Yes, can make a lot of problems, mental problems. Yes, can make a lot of problems with psycho and emotions situation of the patient. And talking about mental stability and our job as a dentist is not only about remaking their teeth by our hands, yes, by our experience and experience of our clinics, experience of our technicians. It's about how to take the people back to the normal life. Yes, a life where they're gonna be sure about themselves. They're gonna be strong and happy. Yes, you know, because remaking of the teeth and that feeling when people can smile and be happy, it's making them strong and sure about themselves. Yes, and it's going in to everywhere, to their jobs, works, family situations, but their future. Remaking of the smile, remaking of the teeth, make people happy, and it's a big problem not to take look at that. Yes, for dentists. And you is going to be a dentist in a couple of the year. You're going to get your diploma. You have to know that some talking with the patient, like that psychological preparing for the treatment. One of the most important steps the beginning, yes, before even treatments. The first step, the diagnostic, yes, and then talking to the people, explaining everything, how you're gonna prepare the teeth, how you're gonna remake it. You have to explain your patient step by step, to be honest with patient, and to explain your patient everything should be clear, easy to understand. So, examination of the patient. Complaints about the organs of the oral cavity and gastrointestinal tract. What does it mean? When people lose their teeth because of caries, of complication of caries, especially molars, premolars, it's making a lot of problems for bite. Yes, for bites to eat normal foods, thick hard food, and people start to use their front teeth, front group of the teeth, to take a food, and in time, the front group of food, not for this, yes, scissors, it's gonna move, yes, in a while, in few months, in 1 year, in a few years, if you're not going to remake molars and premolars after extraction. First of all, soft tissue and bone tissues became less small. Yes, we call it atrophy, and it could be soft tissue atrophy and bone atrophy. Already in few months after extraction of the tooth, this process is gonna start. And later I will show you pictures how it's working. And imagine after extraction of the teeth, if your patient didn't get any temporary crowns, any temporary bridges for normal eating normal food, and if your patient gonna continue eat that food as it was eaten before, it can make a lot of problems with his stomach, yes, with his gastrointestinal tract. Problems like inflammation, bad smell, and a lot of problems like that. And for example, when a patient coming to you and telling you, you know, doctor, I lost a lot of my teeth a long time ago, and now I got a lot of problems with my stomach. I feel a stomach every day, a lot of bad smell from my mouth every day, even after cleaning and brushing my teeth with a toothbrush and paste, it's still bad smell. And how can you explain me? Can you help me to fix that? And as a dentist, as a doctor, you have to understand and have to know that problems could be because of food. Yes, you have to remake teeth. You have to make molars, premolars, which patient lost before, to give him opportunity eat that food as before. Yes, so it's gonna be a first step. Better working conditions, bad diseases, bad habits. Bad habits. Two young men coming to you for examination, just for diagnostic. 30 years old. Yes, one man working in the factory, another one working as a manager in the office. Yes, and that one who's working in the factory with hard metals, with the hard bad air and in high temperature. Yes, so all this around him, that situation, making a lot of stress. Yes, and that one, for example, 30 years old, and another one 30 years old. But first one who's working in the factory already got a lot of problems with his teeth. Caries, cavities, inflammations, radixes, all of that. And another one, just few caries, cavities, small one on the molars. So you can already see the great difference between first one and second one. And it was not about age, because that one 30 years old and another one 30 years old. But we're talking about his job. Yes, he's working the factory. He's working the stress situations. And all of this making a lot of problems with his gums, with his soft tissues, with saliva, and of course, caries, cavities on the teeth. And he could be a young man, 30, 35 years old, and already without teeth. Yes, because of that work, of that hard job, and all that stress situations around him on the work. It's about working conditions, past diseases. When we examining our patient, one of the first questions you have to ask a patient is about diseases. For example, another situation, two patients coming to you, 30 years old, one woman 30 years old, another one 30 years old. But first one already lost almost half of her teeth. All molars already extracted. Half of molars with caries, cavities, and moving. Yes, front group of teeth moving. Huge problems with parodontitis. And another one almost healthy, just few caries, cavities, and that's all. And you start to ask about it. Okay, maybe you work in the factory, maybe you're doing hard job, stress job. She said, no. Okay, what are you doing, Eli? I'm working as a manager in the office. Okay, well, not stress work, in normal conditions, normal temperature. Maybe you have any bad habits, are you smoking or drinking alcohol, or maybe using drugs or something like that, because you should ask all these questions of a patient. And she said, no, I'm not drinking anything, I'm not smoking anything, I don't have any bad habits. And you have to ask, okay, maybe you have any diseases like endocrine diseases like diabetes or something like that. And she said, yes, doctor, since 10 years old, I have diabetes, I'm getting insulin, I'm this diet, and it's making a lot of problems with my health. Yes, and it almost destroyed half of my teeth. And see, she didn't say it since beginning when you asked her. Maybe she forgot about that. Maybe she forgot about the diseases. And when you since you ask her about diseases, she reminded that, okay, yes, doctor, you're right. It's all about diabetes. And for you, it's giving a lot of information, not only about reason of the caries, cavities on the teeth, reason not about gum inflammation, problem with soft tissue, the bone, why almost how the teeth already lost. It's giving you information about planned treatments. Because you have to know that diabetes is a very difficult disease for the clinician, for the dentist, to make a treatment. And it's going to give you more information about how to prepare the teeth, which kind of crowns or bridges or plumps you're going to use for the treatment. A lot of clinicians say like you should not use dental implants with that kind of patients who have diabetes. But as for me, I'm not agree with that. I don't agree with that opinion, because in me, I have a lot of patients who have diabetes, and it's not about disease in general. It's about that level of the sugar in the blood. It's about analysis. If patient controlling that situation, if patient taking medications every day, taking insulin every day, and checking level of the glucose every day, it's okay, it's fine. You can place the implants and to make crowns and bridges on that implants, but you're obliged to control it almost 3 or 4 months to the year. But if people not controlling what they eating, if people not controlling what they drinking, smoking, not taking medications, and all of that, of course, you're not going to place any implants because you're going to lose all of it. And you can become a situation even worse than before. So it's about diseases. When you examine your patients, when you asking them about all these aspects like work, like work conditions, diseases, habits, also, patient should give you all this information. It should be honest with you. And about habits, bad habits, smoking, drinking alcohol, taking drugs. No need to tell like all the bad habits can make a lot of problems with oral cavity in general, not only about oral cavity, all organ system of the body, but oral cavity, oral cavity is going to destroy everything. Carious cavities, parodontitis, bleeding of the teeth, bleeding of the gum, moving of the teeth, teeth sulc. It's just a few problems. You can find the people who's drinking, smoking, and taking drugs. That category of the patients, one of the most difficult for the treatment, because you can never know what they're gonna do later after treatment. You can tell them, please, after treatment, don't smoke, don't drink, don't do any bad habits, or your treatment not gonna work. Yes, after extraction of the teeth, of the tooth, of the teeth, when you extracted that carious radixes, the inflammation, you telling them, please don't drink or don't smoke, because it's going to make situation worse, and it could be very painful and high temperature, and it's not gonna go very well. Yes, the first few days after extraction, and people who's listening to you, who haven't any bad habits, they're gonna do what you're gonna tell them to do. Yes, they're gonna drink that medications after the first few days after extraction, or I don't know, gum treatments, PRF treatments, placing any crowns, bridges, also any other prosthodontic surgical treatments. But people who have bad habits, then you're gonna usually they're not serious. They're not taking you very serious. You're not gonna be sure they're gonna do what you're asking them to do. They can forget about drinking medications. They can forget about cleaning their teeth. Also, so when you're planning to take treatments, someone who has bad habits, first of all, you have to explain. If a patient not gonna listen to you, not gonna do what you're asking him to do, better not to start at all. Because later you can get situations even worse than before, but it's already gonna be your own responsibility. Okay, and third, it's time and causes of tooth loss. Time and causes. For example, patient came to you and telling you, doctor, I lost my tooth long time ago, and now I think it's time to make it. I want to place implant here and make crown in it later. Can you help me with that? Or maybe you can make something else here, like bridge or any plastic prosthetics or something like that. Please help me with that. Tell me what to do here. And you start asking him, okay, tell me please, when you lost that tooth, when you extract the tooth, long time ago. What does it mean long time ago? When, actually? And the patient answer you like it was more than 5 years ago. Okay, 5 years ago. And depend on situation, depend on, for example, upper jaw or lower jaw, depend on the area, front area or distal area. You can understand like, okay, 5 years ago, it was about already about atrophy, soft tissue atrophy, bone atrophy, and it's if you're talking about implants, maybe you have to not only not place on the implants. Maybe it's about bone augmentation also. Maybe it's about soft tissue augmentation also. And you're asking your patient to go and to make a computer tomography, yes, to check on it, to check on bone level and to check on situation around the teeth which around that defect. To be sure, is it possible to place implant in that place or not possible? Maybe you have to make any procedures before, like bone augmentation, sinus lifting, or guided bone regeneration, and or something else like preparing for the place an implant and another prosthetic and aesthetic results later. Or no, patient telling you, doctor, no, not 5 1 year ago. Okay, 1 year ago, it's not too much. It's not too much for atrophy of the soft tissue and not too much for atrophy of bone level. And it's giving you information too. Yes. Or third case, third situation, patient telling you, doctor, I lost that tooth more than 20 years ago. 20 years. And you understand only like 20 years, it's too much. Doing it for 20 years, patient could get a lot of problems with soft tissues and bone level. And I want to show you now how it's working. After the interview moment of the examination of the patient's oral cavity, establishing diagnosis, special preparation of the oral cavity to the prosthetics in case of partial tooth loss. Special preparation before prosthetics for partial tooth losses are carried out in accordance with the orthopedic treatment plan drawn up with these patients. And it consists of the therapeutic, surgical, orthopedic measures, in the preparing of the oral cavity for the prosthetics. And let's talk about anatomical and physiological features of the oral cavity for the partial tooth loss. Changes in the dentomaxillary system of the partial tooth loss. Jaw atrophy. Atrophy. This is the most serious and irreversible experience of the abscess of teeth. Normally, showing pressure evenly distribute the bone with the help of muscles through the teeth, which simulates its erosion and blood circulation full. When the patient has no teeth, what the correct mechanism for distributing the chewing load on the tissues is destructed, and the bone area that doesn't resist the proper load begins to atrophy. What does it mean? No tooth, no bone. Till the moment the two situations in jaw, yes, bone situated around it. Yes, since that moment when doctor extracted the tooth, yes, and patient loosened the tooth, it started the process of atrophy of the bone. It's making less. Day by day, month by month, year by year, without tooth, without blood circulation that area, it's gonna make atrophy huge. Month by month, year by year, till the moment and they're gonna place somewhere there, like implant, or at least bridge or something like that. Something is gonna make the chewing pressure on the chewing pressure on that area. And since the moment patient gets in the chewing pressure, the area of the bone, it's gonna start that blood circulation work in that area. Blood circulation is working. The level of the bone stability. Any chewing load, any pressure, any blood circulation, all this making atrophy worse, less and less. This is a kind of adaptive reaction of our body. Nation of everything that doesn't perform as a function. Such a jaw deformation significantly affects aesthetics. Over time, person acquires an aging face, which adds at least 8-10 years to him. Let's see. Jaw atrophy. Look at this. This first picture in the up, see the normal smile, this lower jaw, and you can see all teeth, this area, the front area, that area, and look and the face of the patient. Yes, this beautiful profile. Everything is healthy here. Everything is normal here. Okay, let's go down. The second picture. I want to apologize for these few Ukrainian words. I'm going to explain. It's a normal condition. It's losing half of the teeth and level of the bone, and it's loss of all teeth and bone level. How it's working? See, well, the difference between this first one picture and second one. That young lady already lost half of her teeth on the right side and the left side, molars and premolars on her lower jaw. Yes, she still has front group of the teeth, and I think she's using it for food and smile. But look the difference in her profile here. Look, check on her lips, yes, and her nose, on your lower jaw, and let's separate her face. 3 parts. First parts here, second one between her eyes and her upper lips, and third one, yes, mandibula. This became smaller. This one, third one, became smaller because she already lost half of her teeth, and it's make situation worse. And the third part of her face, lower one, became less because of the loss of the teeth. And it's not only about teeth and bone level, it's about soft tissues and aesthetic area too. It's about lips, it's about nose, it's about third part of the face in general. That's what we call it, like plus adding 8 or 10 years. Like she's a young lady and she's just 30 years old, But because of all the situations, you can say, like, oh, she's already maybe 40 or maybe more than 40 years old. And look at the third one picture. Third one, it's loss of the all teeth of the lower jaw and total atrophy. See what I said before? No teeth, no loading on the area that teeth, and no pressure on that area, no blood circulation in that area, no bone. No teeth, no bone. It's working like that. And jaw became less vertical and horizontal atrophy. And just check on that face, on the third picture, see? Huge defect became worse. Difference between first one and third one. And all that problems just because she lost of her teeth. But before prosthetics, let's talk what loss of the teeth can make. Imagine loss of the molars and premolars can make front teeth decay. Main chewing load, which normally falls to the lateral areas, is fired to the anterior ones. No molars anymore, and patients start to bite front group of the teeth, making a lot of pressure on that area, and front teeth start to move. Yes, and moving of the teeth in a while, the patient can lost it later. As a result, excessive loss of the frontal area, the acceptable norm cause chipping. Loosening and the fat shape, this divergence of the anterior teeth, progression of periodontal disease, which negatively affects the patient smile. I think it's clear. Metabolic disorders. Poorly chewed food is difficult to digest and absorb, which causes a number of disorders of the patient digestive chain. It's about chronic diseases, and it was about problem is stomach. I was telling that before. I'm not gonna stop on it. So and aesthetic disorders like what occur immediately after the loss of the anterior teeth and for some time after the loss of the lateral teeth, associated with the bone atrophy and the extension of this snail face. This problem is inextricably linked with the human psychology. Complexes appear: fear of smiling and laughing, fear of eating in the presence of other people, like speech disorders, a person lisp, difficulty pronouncing some sounds appear due to impaired bite and lack of the teeth. Again, I was telling all this before the start of the lecture, like that mental psychological problems after loss of the teeth. Yes, fear of smiling or laughing. Yes, and that all that's fear. Yes, making people not sure about themselves. They're scared to smile. They're scared to laugh. They're scared to open wide their oral cavities or open their lips, and they scared to show other people defects of that their smiles, their teeth, and it's making them weak. Methods of preparing the oral cavity for the manufacture of the memorable dentures. Special preparation of the oral cavity for the prosthetics consists of therapeutic, surgical, orthopedic, and orthodontic measures. Special therapeutic measures include tooth depulping, not dependent situation, not always, if necessary. Removing of a thick layer of the hard tissues to prepare the tooth for a half crown, lay plastic, porcelain, or metal ceramic crown. Your wide tooth cavity is determined radiographically. Significant inclination of the tooth when it's necessary to create a parallel of the teeth. Okay, see here are the pictures. We can you can see how to prepare the teeth of the crowns. Look at this. Here we talking about parallel. See this tooth? Maybe it's I don't know, tooth number 47, and this one number 45, and this one with crown, yeah, the place which was tooth number 36 before extraction, and this kind of bridge, yes, you can place here just after preparate of the teeth around the defect. As for me, I don't like such things because I prefer to place an implant here and not to touch healthy teeth without any defects, without any curious cavities, problem with the pulp, any inflammation also. So it's like killing normal teeth around the defect. But for example, if this one tooth were treated before and this one were treated before, plums or crowns a year before, and root canals were treated before, it's absolutely okay if you're going to prepare it, you're going to make impressions or scans, and you're going to place a bridge like this here. But look here, to the pulping if necessary, removing an declare and parallel. What about parallel? When it's necessary to create a parallel of the teeth. See here, this one tooth number 37 and this one number 35, absolutely parallel to each other. If this one gonna look to another side, here for example, there, it's impossible to place a bridge like this on it. You have to prepare part of the teeth till the moment that the teeth gonna be parallel to each other. On the second picture, you can see how it's working by bores. This one aggressive one, maybe green color or black one, and see how this one parallel to second one and third one. Okay. It was about preparation, special surgical issues depending on the vestibular of the oral cavity, transfer of the attachment site of muscles, plastic surgery of alveolar process, deepening of the palatine arc, removal of the base of the zygomatic process of the upper jaw, removal of the exostosis. What does it mean? What does it mean? It's mean if you prepare to place any plastic prosthetics on the area of the that area without teeth, it's gonna be impossible till the moment you're gonna prepare that area by surgically. You have to move the tissue down a bit, because if the soft tissue moving from that place of the teeth to the cheek, your prosthetics not gonna be stability. And the patient gonna eat or smile or open his mouth wider, it's gonna jump. It's gonna be not stability, jump and fall down. And you have to prepare that area, that soft tissue area before. Removal of exostosis. What is it, exostosis? Exostosis, it's a small bone pieces under the gum. Small bone like needles, which you can find after extract of the tooth. If you didn't polish that area by bores, later in a while, few months in 1 year, that bone exostosis can stay there. And if you're gonna make pressure on that area by your fingers, it's gonna be very painful for your patient. And imagine that prosthetics, I'm gonna place the prosthetics there, and it's gonna make value, it's gonna make pressure on that area. It's gonna be very painful for you, and it's impossible for jawing, impossible for biting. That's why you have to do your surgery before. You have to take a burr to make anesthesia there, to polish by burrs or in other surgical instruments. Doesn't matter. That area to make suture there, and in a while, maybe in 1 month or one month and a half, to start with the abrasions and prosthetics. Each operation has its own task as a technician features of its implementation. From this point of view, it's necessary to distinguish the following operations. First one, removal of the single preserved teeth. Second, correction of the shape of the alveolar process and part. Third, plastic surgery of the alveolar process and part. Fourth, creation of an artificial alveolar. Fifth, implantation of metal subperiosteal or other implant, in case if you're going to place implants there. Preparation of the hard palate. Elimination of warts and scars of the cause membrane of the prosthetic bed. Deepening of the vestibule and prosthetic area and floor of the oral cavity. So it was all of this. It was special surgical measures. Special orthopedic or prosthodontic preparation of the oral cavity for the prosthetics. Special loss of the teeth leads not only to a violation of the integrity of the dentition, but also to a violation of occlusal relationships, which prevents effective orthopedic treatment. In the case of significant violence of occlusal relationships between the dentition, prosthetics without our special training becomes impossible. The occlusal surface can be corrected by the increasing of the bite, shortening the teeth, removing the teeth that violate the occlusal relationships. Choice of one of these methods depends on the age and general condition of the patient, the condition and position of the teeth. Psychological preparation before prosthetics. As I said before, it's a very important step in the plan of the treatment. The main goal of doctors is to calm the patient. You have to be, you actually always have to be calm. You have to be politely, talk politely to your patient. Any stress, any special medical words which your patient not gonna understand. You have to explain all your planned treatment step by steps and very clear and easy to understand. Reduce the pain and short and also prevent emotional and stressful reactions that develop not only during the orthopedic interventional itself, but also before it begins. It is well known that success of the treatment largely depends on a patient's willingness to cooperate with the doctor. Mutual understanding between the doctor and the patient is extremely important in the prevention the development of adverse reactions. The main ones are the clarification, reassurance, and encouragement, and providing examples of successful treatment of other patients. Okay, designs of patch emotional dentures. Each removal dentures has its own desired features, which are determined by the position and size of the defect, the number of remaining teeth, the condition of the mucous membrane lining the prosthetic bed, preservation of the alveolar process and parts, the severity of the hard plate and other anatomical issues. Despite the variety of available designs, you can find details in them that are repeated in all types of removal dentures. These include the bases, retaining elements, clasps, artificial teeth, and the arc position. In addition to the base and retaining elements, there is an arc with branches. The base of removal plate prosthetics is a plate made of plastic or metal on which artificial teeth devices for the holding the prosthetics in the oral cavity are fixed. The base of the prosthetic is placed on the alveolar part of the lower jaw and on the upper one, on the alveolar apparatus and on the palate. Chewing pressure from artificial teeth is transmitted through it to the mucous membrane of the prosthetic area. Artificial teeth used to replace defects, and the dentition must meet certain requirements. They must be made with materials that doesn't have any irritation or harmful effect with the general clinician requirements. In addition, the teeth must have the correct anatomical shape, ability to restrain the lack of chewing function, and meet aesthetic requirements. The teeth must not be destroyed by chewing pressure and must be worn out lethal. Made of connection of the teeth to the base material of the great importance. Best are those teeth that are monolithically connected to the prosthetic base. Finally, the material from which their teeth are made must be available and cheap. These are special requirements. Artificial teeth used in modern prosthetics distinguished by the material from which made, the method of fixation in the prosthetics base, and the location in the dentition. Artificial teeth are made of porcelain, plastic, and metal. In comparing bridge plate and clasp dentures from the point of view of restoring chewing function, the bridge denture will be more effective and psychological. A plate denture restores chewing function on average by only 30%. At the same time, comparing the plate removal dentures, the clasp denture has a method of transmitting chewing load closer to the psychological one. After some time, when the denture sinks under pressure, such a denture doesn't relieve natural teeth and can contribute to their function overlay. Look at this few pictures. On the first one, the plastic prosthetics is placed by this metal details to the teeth, and in this situation, patient have just front group of the teeth and what is this? Tooth number 26. And the second picture situation of the it's lower jaw, yes, and on patient has just two teeth on it. That what is this? 47, 37, and 38 even. And what is it's number 34 or 33 even 3. And look at this third one and fourth picture. See this metal details. It's difficult bridge. It's bugle bridge. This metal ceramic bridge placed on the teeth and joined with the plastic part by these metal details. And this area from the right side, on the left side of the jaw, all patient would lose his teeth. But this metal ceramic crowns placed in the teeth we were prepared before. So patient, this front area has teeth. And if you want to use the teeth for such prosthetics, you have to be sure about them. It should be absolutely healthy teeth without any moving, without any inflammation, any recession, and you have to be sure not gonna be broken in the future. And another one picture, this one, number 4. It's bridge 2. How we can use telescopic crowns with the plastic bridges. The combination is plastic prosthetics. So the functionally, since the class dentures is higher than the dentation or molar plate dentures. Class dentures ensure the distribution of the chewing load between the periodontium, the abutment teeth, and the mucous membrane of the prosthetic area. Distribution, the functional, the possible with the help of class and other elements. The desired class denture allows you to split the remaining teeth and eliminate the functional load, the individual groups of the teeth. Class denture reduces the horizontal component of the functional load of the abutment teeth and layer, so as due the more stable fixation. Class dentures not always require tooth preparation, do not limit their psychological mobility. Minor zero on the taste, operate sensitivity of the tissue, the oral cavity when using their dentures. Possibility of the full prosthetics if only few strong teeth will remain in the dentition. High strength and ability of the class denture. When getting used to the prosthetics as it doesn't close the plate. After installing the prosthetics, it is not disturbed. It's not necessary to remove the prosthetics every day at night. There is no risk of prosthetic stomatitis. There is no impairments while eating. A number of ventures are removable in plate prosthetics. First, in class prosthetics, their base part is minimal. Stance, then arc of the prosthetic strength, also stores load between sides. Sense put place with the prosthetics allows you to transfer part of the load to the periodontium of the supporting teeth. The gingival papillae and the part of the mucous membrane are freed. Slight correction of the prosthetics compared to complete removable prosthetics with the deformable fracture. Strong fixation of the prosthetics accelerates the adaptation process, and characteristics of the design features of the modern removable prosthetics, their functional value. So let's go to beginning. First of all, examination. Before making any crowns, bridges, before preparation of the teeth, before making impressions or scan, also you have to examine your patient. You have to be sure about the teeth in that area, about the soft tissues, about the gum and gingiva. If you want to make any plastic prosthetics, you have to be sure like that area gonna be nice for that, gonna be good for that. Not gonna be any inflammation, not gonna be any muscles, any bone exostosis there. It's gonna make pain on the pressure. Yes. If you wanna place any crowns or bridges on the teeth, as a metal ceramic bridges or zirconium bridges, you have to be sure there's going to be any inflammation around the roots, like apical periodontitis or apical abscess also. You have to be sure about endodontic treatment before. Like it's not, should be any inflammation there, any broken and endodontical instruments, and the most important, that teeth should not move. Yes, if you're touching it, if you're checking on it, you're doing your percussion palpation, and you can select tooth moving. Of course, you should not use it, that teeth for the bridges or another prosthetics. because in a while your patient gonna bring the prosthetics with teeth inside. You should remember about what about time, yes, data when patient lost their teeth. 1 year, 2 years, 5, 10 years ago. You should know situation with his health in general, about any chronic diseases, infectional, endocrinal diseases, heart diseases, mental diseases, actually. And of course, about bad habits, yes, because all of result of the treatments is going to be your own responsibility. And if in 6 months, in 1 year, in a while, patient going to come back to you with a huge situation, big defects, big problems in oral cavity, after your treatment, is going to ask everything from you, like, doctor, I need all what you say. You finished my treatment, but that teeth is not for me. I cannot use it. It's painful for me, or my tooth is moving. It's painful, bleeding, bad smell. I don't know. You have to remake everything. And you see, the situation became worse. Because of what? Because of, because of what? Because of diseases, or because of bad habits, or um, because patient didn't do what you asked him to do. But you should remember, in any case, it's your patient. After your treatment, it's your patient, and it's your responsibility. Your responsibility to explain him very clearly that he should pay attention to all what you're telling me, what you're telling him to do. It's about brushing teeth. It's about visiting you as a dentist every few months. Also. Okay, after that, before doing any operation, before doing any surgical, therapeutical, orthopedical preparation, you should check on his diagnostic models. Better to make any impressions for these diagnostic models. Okay, or you can make any scans by scanner to check on it, and to prepare plan treatments for understanding how patient's gonna bite later, how it's gonna make his smile. Is it gonna be comfortable or uncomfortable with the patient? It's gonna work, it's not gonna work. How it's gonna work in few years? Okay. Since about this picture, since patient come into your cabinet or clinic, since he's open the door and sitting on your dental chair, you can see like this part of the face, and this one almost the same, but this one, third one, is a small one compared to the second one, the first one. What does it mean? It means the patient lost his molars and premolars, and maybe not even them. And level of this third part of the face became less, and it's adding what, as I said, adding years the face of the patient. Even young people can look like old people, and it's a big aesthetic problems, which making a lot of mental problems for the patient. Okay, preparation of the teeth. Yes, preparation of the teeth. As I said, you should remember about parallel of the teeth. You should remember about nerve, which situated the teeth inside. And if you have to prepare a lot of tissues of the tooth, maybe better to depulping the tooth, because it's going to be very painful later for the patient. But better to leave him alive with a nerve. Yes, because if you're gonna do endo, since that moment, the tooth is gonna be killed. Yes, better to leave it alive. So what else? Parallels. If you have to preparate for the bridge or crown by burrs on the teeth or tooth or teeth, remember about parallel, as I said. For the bridge, all the teeth should be parallel. Or if teeth is going to be one like this, another one like that, your bridge not going to be placed normally, geometric. Food gonna stuck there. Bad smell, bleeding, all the problems you're gonna get later if you're not gonna prepare this parallel to each other. As I said about surgical preparation, if you prepare to place any plastic bridge or plastic prosthetics there, and it's not too much bone and soft tissue in that area, and you see like soft tissue going from the area of the lost teeth to the cheek or palatal zone. We have to prepare that soft tissue surgically. Yes. What does it? It's remove single soft teeth. It's correction of the shape of alveolar process and path. Plastic surgery of alveolar process and path. Creation bone. Preparation the bone. Okay, what else? I said a lot of this about. Okay. Psychological preparing. Yes. I want to repeat this. It's one of the most, because a lot of dentists think like this talking to the patient, these psychological aspects, not really important. And the most important is like placing implants, gluing veneers or crowns, or zirconium or something like that. Just practice and it's going to be enough. No, it's not enough. You have to talk to a patient. You have to explain. You have to be calm. You have to be honest, because all people can feel that if you're talking honestly to them, or you're lying to them, or you want to hide something, you have to be honest with the people, with your patients. You have to explain very clear everything without this special medical terms, because it's just make a mess in the head of the patient. Better to use something easy to explain, like examples, and you can show your other clinical cases, of course, without face of the patient, just teeth or smile, because it's privacy. You can show results, how you did before with other clinical cases. Yes, just to show your patient like it's working. See, it's working, and you can make a good result. You can get a good result with such treatment, and if you're going to be agree with it, of course. So all of this, it's making a patient calm and agree with you and ready to start treatment with you as a dentist, as a doctor. As I said, provided examples of successful treatment of other patients. So very important.